Welcome to the Healing Pod. I'm Megan, a licensed clinical psychologist.
And I'm Jessica, a licensed clinical social worker, and this is our journey of navigating anxiety as we learn to take up space and create an environment where we feel that we can belong.
Join us together as we learn not just to survive, but to thrive in our anxious brains.
This podcast is intended for educational and informational purposes only. It is not a substitute for professional therapy or medical advice. If you are experiencing any mental health concerns, please seek support from a qualified mental health professional or healthcare provider. Remember, your mental health is important, and seeking personalized professional help is key to your well-being.
And welcome back. Today we have a new guest. We have Dr. Christie, who is the reason I survived internship. Very much so.
That's high credit.
It's a big credit, dude. You got me through a lot. You also got me away from more CBT psychodynamic and into the humanistic existential. So that alone was huge.
Yeah, and you did the opposite for me. I understand far more about CBT than I would have from somebody else. So that's good.
I mean,
Yes,
it's definitely useful.
Yeah, and we would not have made it through internship without each other. I will acknowledge that. That was a particularly interesting growth experience in my life.
So, it was trial by fire in a lot of different ways.
Yeah. Well, we didn't actually have the fire because we unplugged the heaters.
You're right. So Keith we had our lovely supervisor who he would swear up and down and in and out that the second most often reason a company would fail was space heaters. Space heaters are the number 2 downfall of any company at all. People leaving their space heaters on and the business burning to the ground. Don't think he ever told us any personal drama about it.
Well, no, but the business happened to be in a building that was 150 years old or something like that. It was a little duplex that really didn't have much insulation and would have lit up pretty quickly. But there was just one day I had an appointment and I decided to leave my heater in my office unplugged. And when I came back, it was removed from my office and I had a sign telling me that I was no longer permitted to use the heaters. And if my clients complained, then I was to take them downstairs to an office that wasn't really an office. Do you remember that room? It was kind of in between the kitchen and the other room. It wasn't even like my clients got punished because I didn't even leave it plugged in. I just didn't have it sitting downstairs like he wanted it sitting there. So
It
rebellious.
plugged itself back in, so you left a danger there.
I mean, the place might have been haunted. There were children laughing and weird beeping noises for some reason in one of the offices.
Yeah, I think we're clear to let the cat out of the bag on that one. That was one way that you helped me get through that too. One day during supervision when I don't know what it was, that little noise, like Halloween noisemaker, and it had a little magnet on it, and I put it on his filing cabinet when he walked out of the office. And so then when we weren't in there, he thought he got bugged. He took it to the other owner and
they're listening in. The other owner just looks at this device that clearly only has a battery and a speaker and a microboard. He's like, no. And they proceeded to pass it around their office and hide it everywhere for everyone to find because they knew exactly what it was. But he was convinced people were listening to his special secret formula of how to run therapy offices.
Yep. So we learned.
Did you guys at least learn anything?
We learned a lot. Sometimes you learn better what not to do.
Unfortunately, I think about 80% of my supervisors have been teaching me what not to do. Yeah. So it's definitely something I picked up from him and that I keep. No one is allowed to score any of my stuff but me because I can charge for it. And just please don't touch any assessments if you haven't been trained.
Right. Yeah.
It was a fun time. But now that we have both passed from that, Dr. Christie here is also a practice owner over in Michigan and running his own site and trying to grow it there, which is very exciting for you. So tell us a little bit about your site.
It's keeping me busy. We have a practice. We've been here for about 2 years and just trying to expand. A lot of the unique thing that we have now is that our office person is a man and both therapists are men. And in our field, that's kind of an anomaly. So I think in my graduating class from graduate school, when I started, there was 106 people. 11 of them were men. So if that gives you any
Mhm.
idea. So that's why we're kind of starting to embrace it and focus on boys and men's issues and trying to get more into how we can do that. I also did my dissertation on reducing violence in communities. And so we're starting to work with the schools to see what we can do to get in there to provide education or groups or other sorts of interventions there. Doing the emergency evaluations if there's a threat at the school. It's a large school district, so there may be, like a few suicides a year and things like that, and that always kind of goes through the whole community. So,
Mhm.
it's nice to, but we're just starting that, just trying to figure out how we can get in and start to make a difference there. So,
Those are definitely needed. I know even the schools around us, if there's any sort of threat along those natures, the students need an evaluation before they're allowed to return to school. So if
yep.
there's nowhere else for them to get it, it's something that's a good niche to get to. It's definitely a need. We have to make sure the student themselves are safe, that they're going to be able to learn, they're
Mhm.
going to be able to contribute, and that everyone around them is also safe. That where you're avoiding some of these tragedies that are unfortunately becoming way too common across our country here.
Yeah, and younger and younger ages too. I mean, I've had kids as young as 6 referred to me for making threats at school and stuff like that. So,
Mm.
thankfully, a lot of it, as far as the people that I've had referred to me, they aren't immediate threats, but we have to be able to weed through them and be able to help the people that are.
Mhm.
That's
All
amazing.
the
That's so much needed. And you're right. Like, it's so hard to find men therapists,
Mhm.
psychologists, any of the above in our areas. So that's awesome.
Mhm.
That's incredible work.
Yep,
It is.
that's our starting point. We got to push in somewhere.
And it's definitely a good place to push in, which brings us to your breakout session that's coming up. Can you tell us a bit about that?
Well, there's a seminar that one of the community colleges is doing, and it's on families in crisis. And so they asked me to do a breakout group. They have the keynote speaker and then a few different groups for people to break out into. And so that's kind of what the topic is going to be, similar to some of the things that we're talking about today, but just trying to understand what's causing the mental health crisis. How do we deal with crisis when it's in our family? How to understand some of these underlying causes. But more specifically, we're just talking about how boys are different. What's making boys different? Because as we're going to talk about today, there's specific concerns that are more so for boys than there are for girls. So it's not to say that girls don't have their problems and they don't need their support too. It's just trying to make sure that everybody is getting the support that they need.
Absolutely. I mean, it's definitely, there's been a lot of work towards women and women's issues because it has been historically ignored. And it's bringing up that effect where if we focus only on one and we don't balance the other side as well, what are we really doing for the whole picture here?
Mhm. Mhm.
I was going to say, what made you, I mean, obviously we have this problem here, right? And we notice it, but what made you say, like, I'm going to dig deeper into this and start offering a solution to this?
That's a good question. I think there's a lot of things, but it's something that I think the more that I hear about masculinity and gender issues and things like that, and it seems like men aren't being portrayed in the most positive light. There's a lot of, and we'll talk some about that today too. But even experiences like I've had working in the nursing homes, um, people just automatically assume if you're a male that you're a perpetrator, that you're some kind of pervert, and that something else is happening. And so those kind of, and I'm not saying that's true of everybody and everywhere. I'm just saying those are the kind of stereotypes that are out there.
Mm.
So for me, it's just being able to look at like when I hear toxic masculinity, I don't like that term. I understand what it means, but I don't think that it's fair to start calling masculinity toxic. I think it's some of the behaviors that these men are engaging in, and understanding where they're coming from is a lot more productive than trying to demonize it. Because I think outside of academia and people that are thinking of it scholarly, then it just becomes anything that we don't like is toxic. And in general, I'm seeing that too. Even my young daughter, She was talking about this friend who was going through a hard time. I guess her parents are going through a divorce or something. And she said, but she was just mean to me that day. And that's just toxic. And I don't need a friend like that. And that's when I was like,
Mm.
well, wait, let's back that up a little bit because maybe she's not toxic. Maybe she just needs you to be empathic and maybe she needs you to give her that little bit of grace right now because she's never talked to you like that before. She's not treated you like that before. So
Mhm.
that's all I'm saying is it's the way that we look at it.
Ah, yes, when you get those nice little buzzwords that make it easier to wrap everything up and shove it away from you than to do the work and realize I have to set boundaries for everyone, friend or foe, for anything. I have to be able to say, this is healthy for me. This isn't. I can help you here. I can't. To say, what is going on? What you just did is different than how you've treated me every other day this week. Are you okay? That's
Hmm.
that's hard for a lot of people these days, I think, to slow it down and put that work in instead of just labeling it and running the other way.
Hmm. Yep. We'll talk about that a little bit more too.
Underlying behaviors. What is happening underneath all these layers?
Yeah.
That's the hard work. That is.
Hmm.
Yeah.
Well, and it's the same thing like when we talk about violence and stuff like that. There's no one solution. People get on political ideology and things like that above trying to actually solve the problem. And weapons are a problem or can be a
Mhm,
problem, but it's really the people that are using the weapons. And if we don't address the people that are using the weapons and just try to get rid of the weapons, they'll find other weapons. So
mhm,
it's more about addressing those things that are making boys in particular want to commit some of these violent acts.
mhm.
So I know you said you get referrals for school threats, which I'm assuming is majority boys when you get those
Mhm.
referrals. What do you find is usually the underlying factor of them making those threats? Or is there a common theme behind that?
Like I said, the ones that I'm talking more about people who aren't actively having an intent. It was more of a misunderstanding,
Amazing.
like a 6-year-old that gets
Mhm.
stepped on in line and pushes the kid and said, "I'll kill you." That's
Mhm,
at that point, it's really trying to understand what they understand about that word and what that means. Because a 5 or a 6-year-old doesn't really fully understand the concept, of, the terminal nature, the permanent nature of death and that
mhm,
kind of thing. So that's a little bit different. I think when I've seen older kids like teenage boys that are more impulsive. They're making a joke or they get angry really quickly, or we had one, he was online and made a comment and didn't even know that anybody had gotten upset by it, but then it came back and caused a lot of trouble for him.
mhm,
So those are the kind of things that I've seen. But as far as kids that are actually more violent, I think it's deeper than that. And so I think we'll get more into that as we talk too. But is there anything else in particular that you're wondering about that?
No, that was perfect.
Okay.
well, let's start playing. Let's get deeper into some of the stuff. Where do you want to start, Keith?
All right. Exciting.
Mm.
So why don't we start with some of the basic statistics to kind of highlight some of the things that are different with boys.
Okay.
So the first thing is suicide is a huge concern. So
Mm,
the stats on suicide, I thought these were pretty interesting as far as boys are concerned, especially that before puberty, the rates of suicide are equal for boys and girls. Boys aged 10 to 14 commit suicide almost twice the rate of girls. Boys aged 15 to 19 commit suicide 4 times the rate of girls. And boys aged 20 to 25 commit suicide 5 or more times
mm,
the rate of girls. So overall, the gap between the genders has tripled since the Great Depression. So that's less than 100 years.
mhm,
So that's the big thing with men. More females tend to try suicide, but men tend to complete more often,
mhm.
and it's generally because they choose more lethal means.
Yeah, and that's definitely statistics I've heard a lot as well. Like there definitely is that, women tend to go for more poisoning and pills and things like that, and men tend to go more for firearms and hanging and things that have a very much higher success rate.
Yeah.
And
Yeah,
that's yeah.
in my practice, the experience that I've had with people, that men are much more impulsive sometimes with it too.
Mhm.
And so with suicide, I had always kind of thought of it as, oh, somebody's depressed and this just builds up and they lose their hope in life and they lose their connection and their meaning and then this is what happens.
Mhm.
But there was once when I was working in a facility that there was a man that he was diabetic, and so he was limited on how much he was supposed to drink, especially sugar. And
Mhm.
he had already had the one pop for the day that he was allowed to have, and the nurse told him that he couldn't have another one. So he got angry and went back to his room, split the can in half, and then tried to slit his throat with
Mm.
it. So it
Mm.
wasn't deep enough to kill him, but it was enough that he had to be rushed to the hospital and have stitches. And so it was like 1 minute he wasn't having these thoughts at all, and the next minute he's already cut this can.
Mhm.
And so that's that impulsive part of it too, where
Mhm.
sometimes it's just there's just no processing or no coping going on.
Mhm. No, well, that definitely factors in with teenagers. We have a lot of concern for that because frontal lobe isn't as developed. There is a lot of that impulsivity.
Hmm.
Do you know any data or any research on why men might be more likely to have that type of impulsive reaction? Is that a statistic? Is that a study you're going to
No,
do in the
I'm not sure.
future? Hmm. Yeah,
Maybe I should. Yeah, it's a
maybe
great idea.
because I don't know. Yeah, it
Yeah.
could be not, but maybe it is. Hmm. So, there you go. More work for you to do. Just what you wanted, right?
Thank you. Yeah, yeah, that's exactly what I needed.
You're welcome.
Yeah, yeah.
Yeah.
But yeah, so that the impulsivity is something that is more common among men, and so is risk taking. But I'll get into that a little bit more when we get past the statistic part. But I don't want to talk too much time on that. But the depression part, most recently, as of 2021. 6.2% of men in the US had major depressive disorder compared to 10.3% of women. So that makes it look like it's about half. However, men are also less likely to report depression. So if
Mhm.
they have it, they may not even know it or realize it. And if they do, they're less likely to say something about it. So when they accounted for the fact that they're less likely to report, um, they actually and that men kind of show symptoms of depression differently, they were actually put them into there wasn't much of a statistical difference between men and women at all. And so
Mhm.
part of that difference is in the way that men externalize or internalize their behavior. So some of the things that we normally look for in depression are common between men and women, loss of energy or not being interested in things as much, having a low mood. But when it comes to externalizing, men tend to get into more destructive behaviors. So you might see them doing more risky things, something to make them feel alive, something like gambling. Sometimes men might get into some of those more toxic things we were talking about in womanizing or being deceitful. Trying to make someone think that they're with them and it's just them, but they have all these other side partners and they're not being honest about it, or they're making it like,
Mhm.
hey, I want to build a life with you, but really they're just using them. Men are more likely to do those kind of things. And so when we look at those sort of behaviors and they factor those in, that's when the rates seem to kind of come
Mhm.
together.
Yeah, and it sounds like a lot of those behaviors could lead to different diagnoses that, again, have more stigma. Like if you have a conduct disorder because you're acting out or an addiction disorder, it's going to be seen as more of a character flaw than it is depression.
Hmm. Hmm.
Mhm.
So that was about all that. Oh, the other thing that I thought was interesting about depression is that
Mhm.
I was talking about how men aren't reporting depression. However, there's research that shows if they do ask for help, they're half as likely to actually commit suicide. So that is the urgency of trying to get people in to
Mm.
make sure that they're being seen and treated
Mhm.
for it, getting some option to even talk about it or express themselves.
Those are the good statistics. Soon as someone hears you, as soon
Hmm.
as someone understands you, those numbers get cut in half. And that's pretty similar to like I think the transgender and the LGBTQ numbers too. As soon as you
Hmm.
have that supportive, understanding person, those numbers are halved. And that's
Yeah,
all it takes is
absolutely.
hearing. that communication, that connection to someone that says, I get this. Let's go look at it. Let's sit here with it.
Mm-hmm.
Mm.
Mm-hmm. Yeah, and especially in my work with men, I think that's what most men need to start is just being able to have the language to talk about their feelings. They don't even know
Mhm.
how to name things. They don't know how to describe it. And it's amazing to see how everything unlocks once they're able to have the words to describe what they're talking about and to feel like, hey, you know what? Maybe I'm not some loser. Maybe some other people are dealing with this too. Or maybe at least somebody else can understand what I'm dealing with and I don't have to do it alone. That's a
Mhm.
good thing too.
That's an amazing thing.
So, other differences with boys, little things, as far as learning disabilities, there's twice as many learning disabilities for boys. Boys are nearly 5 times more likely to have autism. When it comes to ADHD, the stats that I have are saying between 2020 and 2022, the prevalence of people who were ever diagnosed with ADHD, uh, as far as children between the ages of 5 and 17, it was 11.3%, but 14.5% are boys compared to 8% for girls. So again, boys are almost twice as much,
Mhm.
uh, twice as likely to have the ADHD. And boys also tend to have different forms of ADHD. So again, that's where we see more of the impulsive and hyperactive sort of stuff compared to more of the lack of attention for girls.
Mhm. Yeah, and again, like I know there's a lot more research, especially with the autism statistics. They're bad at diagnosing this in girls. They're just bad. They just suck at
Hmm.
this. They're really bad at
Hmm.
that. So it's still like not catching that difference in presentation and how it may actually be because of these genetic differences. Your brain might be pushed in this direction when you have this diagnosis, and your brain might be pushed in this direction. And maybe we're ignoring that part, but we're also not really paying attention to this part. Because as we're catching
Hmm.
up and as they're starting to say, oh, wait, that kid may also have autism, that girl may also have ADHD, they're still expecting it to show up the same. And it doesn't.
Right. Right, and
Yeah.
then that's what we're talking about here is that we just
Mm.
have to be paying attention to what it looks it may be a similar thing, but it looks different. And
Mhm.
so different people have different perspectives as well. And so that goes into the way that it's reported.
Mhm. Yeah, absolutely. So, what do we do with this data? We have all these differences. What are you looking at with this?
Well, to me, it's understanding some of the things that underlie why some of these statistics are the way that they are. So, one of the things that I wanted to start with is kind of talking about the concept of a hero paradox. So, we're looking at men have traditionally throughout history been the warriors. They're the ones that are prepared to go off to war to protect everybody else and ensure the survival of our species, right? So there's always that sort of tough guy thing about us sometimes. And the paradox of it is though is that you're taught to value yourself by not valuing yourself. So some of this
Mhm.
might sound a little controversial, but I'll explain myself. The other part is, that there's the sensitivity to death and suffering of boys and men is in competition with our survival instinct. So what do I mean
Mhm.
by that? I'm looking at when I say that, I mean that we have geared boys towards warriors so that they
Mhm.
can protect us, so that they can keep us there. So, therefore, if we take that warrior out of the boys, then who do we have to protect us? Who do we have to make sure that society continues? So, again, not saying that girls can't be in war and that they can't help with those sort of things. I'm just using this to kind of illustrate the point.
Right, right.
So some of the things that happen are the way that this is kind of maintained is through social bribes. And I think that there's some things that seem pretty obvious, but people aren't really paying attention to them.
Okay, like what do you mean?
An example of social bribes. So what do I mean? Social bribes are kind of ways that things in society reinforce certain behaviors or guide us in a certain direction. So for example, preparing your son for manhood by putting him on the football field to be a football hero. Again, you're kind of teaching him to sacrifice his body in exchange for the social bribes of praise and value or
Mm.
status, esteem, those
Okay.
kind of things. So again, just an example. It doesn't
Mhm.
mean that if you're playing football, then that's automatically something wrong. So
Right. But if football is the only way you find that reinforcement, is the only way you get that identity of you are good enough, you're winning on the football team, therefore you're my son, but if you're doing your homework, you're not really my son. Why don't you just go do something else useful? That can
yeah,
definitely sit in pretty hard.
and as far as the hero paradox goes, or relating that even to a warrior, if we are sending somebody off to war, it's going to
Mhm.
be a similar thing as on the football field. There's a lot of things that are similar. Like, are we going to? I'm sorry, I'm losing my train of thought for a second. But if the for the social bribes, if we're putting men on the field, that's one example. When we're talking about doing it as a warrior, so look at some of the advertisements that have been used for recruiting people into war, and it's sacrificing our sons for
Mhm.
the good of the people, or for whatever else. Maybe it's the uniforms, the allegiance, the family that comes with it. There's a lot of things that kind of can entice men into going and risking their lives for people that they don't know. And then the problem with that sometimes is that service then turns them into a poor lover. They come back
Mhm.
with PTSD, or they come back with mood problems. They have come back with problems adjusting to normal life. And so they go to war thinking, hey, I'm sacrificing myself so that I can get the love, so that I can have the connection and the family that I want. And then those very things are what make
Mhm.
them a terrible lover. So
Mhm.
does that make sense? I know I got a little stumbly there, but
I think so. I mean, do you like just you got your young boys here at home. Does this sound pretty familiar? What you're seeing aimed at them? How's this landing with you?
Yeah, absolutely. I mean, everything that you're saying really kind of fits in. So my specialization is in veterans and first responders. So I mean, that's right there, right? And that social
mhm,
bribes. So I see it a lot with that's what we're working on healing of how to be able to connect in a different way and not based off just what they gave to their country or gave to their community. And then the same thing with my son. We had this conversation just the other day because they just started school clubs. He's in fifth grade. What grade's my kid? And he's in fifth grade. Um, and all his friends are doing sports. My kid is not a sporty kid. I was like, you can do it, but like, are you sure? He's like, oh, but all my friends are doing it. And then I noticed when we were looking through it, there was drama club. And he's like, Mom, this sounds so cool. And I'm like, well, awesome. Let's do it. He goes back to school and one of the kids said something to him. And he came home the next day. I'm not doing drama club. It's gay.
Mm.
I'm like, what are you
mm,
talking
Mhm.
about? He's like, I have to play sports because otherwise my friends aren't going to be friends with me anymore. I was like, yeah, we're not going to do that. You likes drama club. We're signing up for that. So he starts Wednesday. So we'll see how that goes. But we had
yeah,
that
good for you.
conversation of you don't have to sacrifice things that you love
Mhm.
for you to make other people happy because they're not going to be your friends forever. And if they're not
Mhm.
supporting you in what sounds like fun, then maybe they don't add to your life.
Right.
Yeah. Yeah. So, like, part of the social bribes to me sounds like a false promise. So there's definitely that setup of, oh, we like men that meet this category of we're supposed to like men that meet this category. So if you meet this category, you get all this attention, you get all this support, and you get all this love. But by meeting that category, being the big burly, I'm going to save the world and be a military person, you're exposed to so much trauma that it takes you away from getting that reward. Like you're saying, it takes
Mhm.
you so that you're not getting love, you're not getting family, you're not getting connected. So like just your son would go into sports and not be good because it's not his thing. He doesn't love it. He's not wanting to do it. And bless his heart, he'd be so adorable. And the friends
Yep.
that aren't really his friends would still be little buttheads to him. And then I would
Yeah.
want to go yell at them. And that's not good for an adult to do to small children.
Exactly. And I'm like, what's wrong with being gay? That's awesome,
Yeah,
dude. Like,
seriously. Try it. I'm
someone
fine.
suck it up.
Yeah.
I was like, hello,
It might
our
work out for you.
self-claimed anti-May is
Yeah.
amazing. And he's like, that's true. That's not a bad word. I'm
I
like,
am
exactly.
amazing.
Tell your friends to shut up and find new friends.
Seriously. We got so many better ones out there. Yeah, like if
Yes.
if we can and then there's this whole like how do we solve these problems without completely and utterly throttling society and shaking it to get it back to its senses a little bit here, which is what you guys are working on.
Yeah, just gently. Yeah.
Just
And
gently throttle it.
right, right. And other things that, kind of lend into the warrior sort of thing, just
Mhm,
to kind of add to the metaphor or the analogy, is thinking about like even men in their healthcare, where men are
mhm,
notorious for, oh, it doesn't hurt, or I don't feel that, or I'm not going to go to the doctor for that. Well, that's actually an adaptive thing when it comes to survival, right? Being able to say, oh, I can't pay attention to every bruise or every scratch or
mhm,
every ache and pain or the sore throat that I have when my life is at risk. So, I just thought that was kind of interesting to put that in that perspective too, that maybe that's why we are so guilty of chronically neglecting ourselves in some ways
mhm,
too, because we don't value ourselves. It's more about what we can do for everybody else. And
mhm,
that need to be needed. I've heard women complain about that one too, but it's true. It's there.
mhm,
There's a
mhm.
need to be needed. So
Absolutely.
I
And I
don't know
think
what you
it
guys' experience or perspective is with that, but
well, I think it falls the same, like, opposite ways because there's that you're not allowed to be sick, you're not allowed to have an injury, your arm can be chopped off and bleeding, but someone's gotta climb on the roof and fix the shingles, so that's what I'm gonna do one-armed, watch me do it, it has to get done. And
mhm.
then
Mhm.
and then you have the man flu. So you have this opposite side where you're
Yes,
just
right.
sick enough in a way that you can accept being taken care of, and, oh lord, do you need
Yes.
to be taken care of.
Yeah.
Yeah.
You gotta make up for all of it at once. That's right,
I
yes.
really think it is because it's all or nothing here. It's not, "Oh my gosh, my arm is hurt. Let me take it easy. I'm gonna do everything because I have to, and I have to oh, I have the sniffles. I can't function." It's like that
Mhm.
one
Mhm.
excuse that is acceptable enough,
Yeah.
and you need it. So that's what you lean into because it's not
Yep.
actually balanced anywhere else.
Mhm.
Mm,
Well, what happens when you fall into that wormhole of
mm,
both partners needing to be needed?
Mm. Megan, that
mm.
sounds like a question for you.
So when you get the two people pleasers together, you start a podcast. No. It is a tricky thing because you want to deny your own needs in order to support the other person's needs, but they can't identify their needs because they're so busy denying their needs in order to support your needs that you start almost guessing at what the other person needs, and there's that lack of actual connection. Each of you
Yeah.
is bending over backwards to take care of the image of what the other person might possibly want and need,
Mhm.
and you can't step into it fully. You can't step into it as your own full person if you don't bring your own wants and needs and preferences with you. So you're
Mhm.
having this beautiful, loving, caring relationship between puppets that you're just kind of like, I'm up here and I can't bring all of me into it yet until I do the work for that.
Yeah. Well, I just think it's important for everybody to know that you're loved regardless of what you can do for me.
Mhm.
That sort of unconditional love. I think that's the tough part, is just being able to show that unconditional love. And if both of you are feeling like you need to be needed and those needs aren't being met, then that's what you got to figure out.
Mhm. Yeah. And there's so many things like once you figure out what is this need, is it reasonable for the other person to meet it? Is this
Mhm.
possible? If you have one person and they're supposed to be your best friend and your confidant and your perfect lover and your home chef and your chauffeur and the housemate and like all of these things, that's a tall
Yeah.
order. That is a very
Yeah.
tall order for one person to fill. And that might not be reasonable. They might not be able to do some of this stuff. They might not fit. And that is where outsourcing is good. And I'm talking about hiring someone to do your lawn service, but Jess is laughing at me. It could also just be bringing in a gigolo or something. That works too. But sometimes,
Wow. Yeah, that was a little different there.
I promise it's just tea tonight, guys. I promise.
We
Maybe.
went down a totally different pathway on that trail.
I know, but you laughed at me,
That's
so
why I deflected that one to Megan. I was interested to see
you
where she'd
know I
take
do
it.
this shit.
Just like,
Yeah, we gave up on ratings on the podcast too, by the way, if you want to lie or if you want to lie. Don't lie, but if you want to swear, go for it.
oh, okay, good. I'll,
Yeah.
I'll keep that in mind.
Talking
So,
about
yes.
gigolos, my body, my choice.
Yeah.
Yes.
Wow,
It's
welcome
like,
to that. So
yeah.
I was talking. I wrote that on the note sheet.
Mhm,
About my body and not my choice. And when I
mhm.
was reviewing it, we thought maybe that was a little too controversial to say it that way. So I wanted to at least
Nah.
bring that up because these are the tough things. That was some of the feedback that I had gotten. So I just wanted to make sure that I was clear. But when I mean that, I'm talking about limited choices, or as I said, kind of that sacrifice of your body, or
Mhm,
feeling like others' needs for your body are more important than your own, that
mhm,
sort of thing. Um, and so it's some examples of that start early in life, or especially in our
mhm,
country with circumcision. In some
mhm,
cultures, it is something that men can choose, or that they're at an age that they can understand. But that's certainly something that we don't tolerate for girls, and it's just commonplace for boys. And I'm not necessarily saying that it's wrong or it's bad either. That's something that you have to decide on your own, but it's just an example of boys not having autonomy of their body, or not having that choice,
mhm.
from the start sometimes. Other examples, like we are talking about football, is I don't know why we're knocking on football today, because hockey is probably worse. Um, as far as knocking out teeth and causing serious brain damage. We got boxing and other sports too,
Mhm,
but just being able to, hey, well, he might have at least now we're getting that now. Hey, he might have a concussion. Let's leave him out of the game. But it used to be, hey, oh, he can get up and he can walk. Let's throw him into the next play.
mhm.
And so then you got this 16-year-old boy who's out there just trying to get the praise and the victory, and he ends up sacrificing his brain for the rest of his life. So again,
Mhm.
those are just kind of examples. So I'll leave
Yeah,
that
and
with
I
you.
think
What's your comment?
do you wanna take it, Jess?
Either way, yeah, no. So I'm right that when you said hockey, I'm wearing my hockey shirt tonight.
There you
Um,
go. Yeah, I'm from Detroit, so hockey's pretty big.
yeah, yeah, we're all about that Tampa Lightning here. So, but right there with the hockey, right? Like even as grown men, like this is their career, and there is that recognition of if I don't sit this one out and heal, then my whole career could be over. But then there's still almost like that all of these people cheering in the stands. So how much of it is really their choice and how much of it is somebody telling them kind of are you sure you can't just like shake it off, stick it out, get out there. Like you
Right.
see blood coming out of them. They if I took that hit, I'd be crying like a baby. And they just keep
Hmm.
playing. Like they shake it off and they get right back out there and keep playing. And it just really like that whole concept makes you really wonder how much is actually their choice to keep putting their body through that in those moments with contracts and people over their heads saying you need to do this.
Hmm.
And it starts
Yeah.
so young.
Absolutely.
Yeah, I
And
think that's
it's
a good example of the social bribes too.
yeah, and like, with that, when you're getting into that with the sports and everything, like, high school is not that important. High school sports are not that important unless you're in the South playing football. Then suddenly they
Mhm.
are. Like, no, they're really not, but you're permanently damaging these kids in order to maybe potentially make a lot of money off of them in college.
Right.
Like, they don't make money at all. Maybe a scholarship, maybe.
Hmm.
I think there's a couple schools now that said, "Okay, I guess we can pay our players too," but this is just purely other people making money off of your sacrifice. Other people playing it up to you so that they profit
Yeah.
and convincing you
Yeah.
that you are profiting while you do that and that it's a good thing you're profiting while you do that. And what's left at
Yep.
the
And
end?
that all gets complicated. Hey, at least if I can make money, I'll throw my body away, but at least I'll make
Mhm.
money.
Which
Yep.
is the theory of working anyway, but.
Well, and since you mentioned that beyond
Mhm,
sports and things like that, the other stat I didn't really talk about is, that I thought was interesting too, is that as far as workers go, men tend to take those jobs that are more risky too, that are more likely to risk their lives. So the stats that I read were 150 workers die per day. 92% of them are men.
mhm,
So that's that's a huge discrepancy
mhm,
there too, as far as who's putting their lives on the line, who's willing, in that way.
mhm. And I do think, like, we always wanna make sure that we're balancing the statistics too. So part of that is women weren't allowed to take those jobs. So there is
Right.
that
Right.
stigma there as well. And even that still gets tied into, let's force men to be in more danger because we wanna protect the poor. Like, nobody is making it good out of these stereotypes. Nobody is actually benefiting from this
Right.
nonsense. It's painful on both sides.
No, you're
People are
exactly
literally
right. And
dying.
right, that's why we want to address these issues too, because just as much as girls' issues affect men, men's issues affect girls too. So,
Mhm. Yeah. Say if we can actually keep both sides in mind, like this has never been about who is better, who needs more. It's about everyone being human and everyone
mhm,
deserving the right to be a full, healthy, connected human with the supports that they need in life.
yeah, yeah. And connected is a good segue to the next part too, because that's where I think we need to go with this part of it. I mean, you guys can talk about your experiences too, but I've observed a lot, especially since the pandemic, where people are just not as social anymore. They're not going out, they're not getting together, and when they are, they're short tempered. They get offended easily, and nobody wants to stay for very long. Like little things. Like I was in a nice restaurant a couple months ago, and a place that would have been popping on a Saturday night, but we were the only ones in the restaurant, and there were about 12 people waiting for takeout. It's a nice restaurant. It's the type of place
Mhm.
people used to just go sit. You wouldn't even think they'd offer takeout, you know? But now it's like people won't even take the time to sit and do those basic things. So we're more and more isolated. And when we're
Yeah.
talking about girls in the way that they tend to socialize, girls are more socialized to talk about their feelings. They're more socialized to have those meaningful connections, so when something goes wrong, it's already kind of ingrained in them. These are the people I can talk to. This is going to make me feel better. If you ask most boys about the quality of their relationship with other boys, they're not talking about their feelings. They're not being vulnerable with them. And actually the funny thing is the more that I talk to other men, it seems like men go to female friends for that, which I don't know, Megan, maybe enter you internship year.
Yeah. This is why we survived well together, guys. But how are you approaching this? So you're working on these concepts. You're working with presumably more of this masculine and male population. How do you start to get to that vulnerability? How do you create these openings for them?
I think the first part is, as I was kind of talking about earlier, is just starting to learn the words to describe things, to understand things, to be able to, sometimes for people to just to be able to go back to childhood and talk about some of the things that happened, and how they're affecting them now, how those relationships, a lot of it seems like men aren't thinking about these things. They're not placing it together. They might not understand that the way that mom talked to them is the reason that they are. Maybe they do. Maybe that's why they're really angry. And so that's a different way of going about it. But I don't remember exactly what your question was, and I don't want to go off on a tangent.
Why not? I like tangents.
I'm good at
Nothing wrong with it.
that. So yeah.
Well, I think generally it's just kind of that question of, if somebody's listening to this and says, "Oh, yeah, maybe I recognize some of that pressure myself." Where
Yeah.
do they even start?
You mean what should they be looking for?
Yeah. What should they look for? What should they do? Like, how do we start shifting this massive train wreck that is our social gendered structure?
Well, generically or generally speaking,
Mm,
it's about being not getting rid of that sort of heroic intelligence or that hero part of us, but being able to get in touch with that softer side. I was raised in a family with three boys and a dad who was very old school masculine, and I am more like my mom. And so that's also why I'm the psychologist in the family, right? Because because I get both sides of it. And to me, for me, being a man is about knowing when to be tough, when to be strong, and knowing when to back off and when to connect, when to solve a problem and when to just stop and listen. And that's a big thing I'm sure you guys have heard of too. The differences in men and women, where men want to solve the problems all the time, and sometimes you don't want the problem solved. So
Mhm.
sometimes we just need to be able to sit with that, to be able to think. For men trying to build that empathy, it's almost like looking at it as like a story or showing them somebody else. So sometimes, if they're having trouble getting their own feelings or how they should react to something, what would you say about your best friend going through the same thing? Let's look at it. Let's play it out. Looking at it from that angle then helps you see, oh, okay, that's why I did that. To be able to make those connections, to know when to be a little softer, because
Mhm.
sometimes it's good to be able to show your strength too, but it's being able to dip into either side of that as you need it.
Mhm.
Being able to have more empathy allows us to connect more to other people. It allows us to be better fathers, better partners, better, really in everything that we do. So the everything that we're doing is involving people, whether it's at home or it's in the community or at work or whatever. And as I was saying earlier, for a lot of people, we're more and more isolated. So just being able to encourage people to connect and helping men understand the importance of, you don't have to talk to everybody about your feelings. I'm a psychologist and I suck at talking about my feelings sometimes. But when it comes to my wife, I will be vulnerable. I will allow myself to talk. And as tough as my dad is, I hope he's not listening to this, but I think he was vulnerable with my mom sometimes too, just never to anybody else. So, but we all need that. We need that
Mhm.
soft spot, to be able
Mhm.
to let it out, where we don't have to have our mask up and feel like we're so strong all the time.
Mhm.
Is that a long enough winded answer for you?
I love it. I also have a new life goal of making your dad find this episode someday. Don't know your dad at all yet, but someday I will find a way to make him find this episode.
Yep, he is an incredible man. I'll give him that much. He has taught me a lot about being a man, and about being a good person. Because as tough as he is, he also taught me when to be generous, when to be kind, when to set down the swords and accept the loss. Those kind of
Yeah,
things. So,
yeah, I love it. Yeah, because it really does seem to just kind of come back to that recognition that, we're talking mainly about men here. Men are full human beings. And to say you have
mhm,
to only be this one side, this one aspect, this is all you are good for is only killing us. It
yep.
really is. Like all it does is hurt. Yeah.
And earlier, when I was talking about kind of expressing your feelings, or the way that we express feelings, the most socially acceptable is anger. And that's the
Mm,
easiest for us to feel. Feeling depressed, it's just sad. You don't have any energy. You don't like anything. You don't want to do anything. At least when you're angry, you can do something about it. Right. And a lot of times that becomes destructive. But
mm,
what's behind anger? Anger is a secondary emotion. So this is another thing that I like to think about in men. For example, I had an uncle that passed away a couple months ago, and my cousin was at the bedside before it happened, and he was really struggling with his feelings. And he had said something about how his dad was tough. He was never afraid, and he just kept going through everything that happened. He just soldiered right through it. And I stopped him and I said, I don't know that he wasn't afraid. I think that
mm.
he just didn't let it stop him.
Yeah.
And to me, that is what we need to focus on. Being strong and being tough is not about never feeling fear. I think it makes you tougher and more of a man to say, I need some help, or to say, you know what, I'm afraid, but I'm going to do this anyways. I'm going to
Mhm.
find a way to do it. Maybe I need support. Maybe I need to train myself. Maybe I need to learn something else. So those are the kind of things of just being able to acknowledge that we do have fears. We do get scared. And
Mhm.
as I was talking earlier about depression, I always thought depression what was behind anger. But for myself, and the more I talk to men, I think for a lot of men, it's anxiety, it's worry,
Mhm.
it's fear. and we don't know how to process it. We don't know how to deal with
Mm.
it. So we just go straight to anger.
The fearful dogs are the ones that cause the most bites.
Yeah.
it is a thing because it's that, you go
Yeah.
back to what you were saying at the beginning with that impulsivity. You get stuck in that corner and you feel like there is only one way possible to get out, to save yourself, to save everything that's important to you, to survive.
Hmm.
That's the way you're going to go.
Yep.
Makes sense to me. Anything else you want to add? Any other advice you have for anyone listening to this today?
Well, I mean, I could talk for another 3 or 4 hours if you wanted to, but
Oh, absolutely.
at least we're
That's
all in
the
the same
extra
time
bonus
zone
cut.
here.
That
Yeah.
does help.
Yeah.
Yeah. Yeah. But no, I'd be more than happy to come back and talk some more about any of this or anything else if you're interested in that. But I appreciate the opportunity to come on and get some of this stuff out there and try to let me fumble through my words a little bit too and try to get a little bit better at speaking as if I know what I'm talking about.
Oh, you're doing excellent. Don't worry.
Yeah,
We'll
Yes,
edit
thank
it.
you.
definitely. And we appreciate you coming on and sharing and talking about what you're doing because I feel like we talk about, a lot on the women's side because that's what we
What we
are,
know.
right? It's what we do.
Yeah.
But I feel like it's also showing that there are male professionals out there who are trying to
Mhm.
show that it is okay to bring that emotional side of things into it and recognize that it's okay to feel connected to other people and it doesn't take away from who you are on the
Hmm.
masculine side of it too. So I think that's amazing and I appreciate your time and in the words of Brene Brown, like if it's uncomfortable, talk about it, right? Like you were talking about,
Mhm.
everybody was
That's
telling
right.
you not to go into that body, not my choice. That's part of being
Yep.
vulnerable. Get out there and do it.
No.
I think that's the
And
definition.
that's right. I thought I was safe. I'm at least talking with 2 women, so I expected you 2 would keep me in check if I got out of line.
I
That
will.
was my expectation from the beginning. Yeah.
Jess is my counterpart. She is a lot like me. She will definitely keep you in line too.
I make everybody
Yeah, I
uncomfortable. So
appreciate that.
It's fine.
Hey, that's what makes us better.
You make everyone uncomfortable. I'm the one with the gigolo comments tonight, so I don't know.
that's true. Hey, in all fairness, like I'm
Keep it
a
real. Thank you, Megan. Yeah.
Of course. Always good to be the comic relief.
Yeah.
But yes, thank you so much. I am very happy to finally be catching up with you. I have been a horrible friend and not nearly as communicative enough, but I exist and now I get to stalk you and catch up with you again more, which makes me happy. So I'm good.
Well, we just proved that we're good friends though, because sometimes good friends don't talk for a while, but when they do, it
Mhm.
feels like no time has passed, and here we are.
Yeah. Yeah.
So,
There's just holes
yeah,
to fill in. It's like, all right, let's just pick up and keep going. We got this.
that's right. Yeah.
But
those are the
really,
best
I
kind of
do.
friendships.
Oh, they are. They're awesome. I really do appreciate you coming on. I mean, like just said, we have our side and our experience, and it's good to check you if you get online, but it's good to be checked and to be reminded,
Yep.
hey, this other side is really important too.
Yep.
Pay attention. We have a lot of statistics here that we need to figure out the causalities of and get some work on them. Let's get all these numbers halved. You know,
Yep.
we just
Yep.
need to. Yeah. So thank you so much. And thank you everyone for listening. If you want to find us online, we are all over the place. We are on Spotify, we're on Apple Podcasts, anywhere you want to find the Healing Pod there, we're there. We're on Patreon at the Healing Pod. If you want to see bits and pieces that I cut out of here, we'll be on there. We'll buy Jess a cup of coffee and possibly more painkillers. We'll see how she's doing. Where else are we at online, Jess? Where else can they find us?
You can also find us on all your favorite social medias. We are on Facebook, TikTok, and Instagram.
So we're pretty much under the Healing Pod in all of those, I think. We're in the P's and the
Mhm.
Healing Pod in some of them, but we are stalkable. We're findable. What can we say? But thank you again, Dr. Keith Christie, for coming out
You're
and for
welcome.
joining
Thanks
us
for your time
tonight.
too. I appreciate you having me.
Of course. And hopefully we'll get to talk to you again soon. But till then, we'll be back in a couple of weeks. So take care, everyone.